The findings of the respiratory ancillary methods. So the guttural pouch. You can use radiology for lateral ventrodorsal view. You can see mycotic infections and empyema, fluid accompanied by masses seen within the pouch. For endoscopy, so you go through the nasal maxillary and you can check for sinusitis. You go to the butterfly at the end of the soft palate, and this is the entrance to the guttural pouch. You put a wire in, you go under the flap, and you push the camera through and you retract the wire. Empyema is a purulent discharge at the pharyngeal orifice, and mycosis is critical for diagnosis. Is there bleeding from both pouches? And you can also get culture, like a Streptococcus equi. For the pharynx, you can use ultrasound or ultrasonography. So for dorsal displacement of the soft palate, DTP-SP. For the larynx and trachea, you can use endoscopy. So for the trachea, it's usually thin mucous membranes and it's swollen in the case of infection. For laryngeal hemiplasia, there's adduction following swallowing, and there's a grading system 1 to 4. At 1, all the arytenoid cartilages are synchronized and symmetrical. At 2, the arytenoid movements are asynchronized. At 3, the arytenoid cartilage doesn't have there's full abduction of the arytenoid cartilage. And at 4, there's immobility of the arytenoid cartilage. And then arytenoid chondropathy, this is the presence of intraluminal projections of the granulation tissue. And you can use dynamic endoscopy on the treadmill for accurate diagnosis. There's no sedation as this changes the muscle reactions. And there's a grading system. Full abduction of the arytenoid cartilages during inspiration is number 1. Number 2 is partial abduction of the left arytenoid cartilage. And number 3 is abduction less than the resting position. You can also use ultrasonography, so the arytenoid chondropathy. This is abnormal enlargement. And then you can use radiography, so you can see tracheal collapse. So for the thorax, you can use ultrasound. So when there's no air inside the lung, this is a consolidated lung. You can also see hyperchondritic parts like snowflakes. This is pus and fibrin, and these are signs of gas production of bacteria. And then fluid, it's clear, it's just black, and it can be drained. And for radiography, you do it during full inspiration. You can see from dorsocaudal, ventrocaudal, dorsocranial, and ventrocranial. And it can be used to diagnose pneumothorax and pleural pneumonia. And you can see changes in the size of the pulmonary arteries and veins, and the pattern could be bronchial or alveolar.